teens are more likely to have attempted suicide without first even having plans in place, right? And so that's a problem because a lot of suicide screening mechanisms ask about prior plans. And if they didn't have any prior plans, then this wouldn't show up. So we need to be better at figuring out better questions, right? We know that interpersonal problems are a part of suicide across all races. And we know that white youth had highest rates of reporting or being diagnosed with current mental problems as compared to other groups. Now, what does that mean, right? It means that, like, is it having a mental problem? No. It's being diagnosed or reporting mental problems. And therein where I think the rub is that we are, as blacks, are not as diagnosed. The statistic of a 10-year gap between onset of a mood disorder and treatment is still the norm, 10 years. If you think about the pain, the suffering, the tremendous loss of resources in our community that happens to kids, the loss of confidence, all of these things that happen when we have that long a period of time between when someone is diagnosed and when someone feels symptoms and when they are treated. Black children have lower rates of reporting current mental health problems or being diagnosed with mental health problems. Even those who've had prior suicide attempts are less likely to be diagnosed with a mental health disorder. Again, crises and problems with family relationships are now being studied as being highly correlated. So the reason why I keep emphasizing this point is that when you are arguing with your child, when there's big conflict, watch them, right? Don't just assume that it's just typical. When you see atypicality in their behavior, when they're slamming doors and they've never done it before, pay attention. Get some help. So what's behind the rising suicide rate along with the rate of depression and anxiety? Academic rigor. You know, the kids are under more academic stress. As a parent, parenting Darian through high school, you have to be good at a lot of things, right? We're all working. Social media. You know, we didn't have to contend with our children carrying around in their hand. Every person in the world has access to them. Every person in the world can say anything to your child. So we have front-loaded academics, right? We have things, kids are learning things that are harder earlier. What hasn't changed? The brain is still the same, right? Child development is still the same. The sensitive periods where you're more prone to learn algebra is still the same. Human emotions are still the same. Executive functioning capabilities, no disrespect to the boys, but they're still the same. The number of slots in top 20 colleges are the same, right? We're just all pushing our kids more and more toward them. Our expectations are very high. I'm giving this its own slide. Why are teens stressed? Racial trauma. Our children have endured and are experiencing race as it takes its toll on our psyche, our emotions, our bodies, and you know, our systems are at a brink. I've had more adults, everyone is reporting increased symptoms, the highest in US history since they start keeping statistics on mental health. So we see the typical ones, major life events, heredity, environment, achievement-related stressors, which I wanted to skip too quickly. Our children must go to a top school. I had a woman tell me, every single one of my children went to X college, and this one has to go too. You have to be able to schedule our expectations, gender roles, juggling. All of these things create chaos, and it's chaos in an already troubling time. If you look at what nicotine, the loss of our routines, the loss of our celebrations, even the loss of the celebrations of life in terms of funerals, police brutality and civil unrest with the murder of George Floyd, and of course many, many others. We were in a mental health crisis prior to COVID. And so no one, we fail to acknowledge that now only 20% of our children are getting help. We have a lot of barriers in the African American community about getting help. And we face stigma. We still have people that think that religion should be a barrier, that you cannot pray and have a therapist at the same time. I think that, I tell the parents all the time, who do you think put therapists here? And also, we have this facade. We want to put forth a Facebook facade. We want everything to be okay. We want to report that our children, that's my timer. We want to report that our children are perfect. That we only want to report their achievements, and that is very crippling in the African American community. So that's my nephew. Isn't he adorable? So we're going to talk about Christian. Darian said, do not put him up today. So we want to talk about what the recent trends are saying. They're saying that early identification and treatment of underlying mental health conditions, interpersonal problems, skills training. Because you notice how the conflict, the family conflict, the friend conflict, the breakups, I'm treating more kids because they broke up with a romantic interest. Family-based interventions that improve your interactions. And so those are downstream, where we have to treat the child. We also have to look at the systems. We cannot just fix a child and place them back in a broken system. So we still need all of y'all out there fighting healthcare disparities, social determinants of health, including racism. One of the things that I do is that I go out and train other psychologists, and I'm just keep going out there, okay? Dr. Lindsay has this program, LaBonne Williamson has this program, Success Over Stress, where they're working with kids in schools in order to develop coping mechanisms, effective coping mechanisms, and they deal with race. So I'm going to talk a little bit really quickly. I know I'm over time, but I want to talk about parents for 1 second. All you parents out there, the number one thing to really address in terms of your parenting is to know that racial trauma impacts you. And you have to work on your own healing before you can effectively parent. And that's it. If I say nothing else to you, that would be it. If your 15 teachers tell you that your child is anxiety, you should listen. Even if you don't trust them, go ask someone else. Timely intervention. Do not address problems when they're small. Don't address it when your child is shut down from school, won't leave their bedroom. Trust your instincts. Parents, I have all the time here from parents that tell me that they had the instinct 10 and 12 years ago. Well, trust that instinct. Fight the spouse that doesn't want you to do it. Real talk. Finally, there are lots of medication, self-care, self-advocacy, and one of the things that I want to really talk about is if your child needs accommodations in the classroom, even to address emotional issues, but also undiagnosed learning and executive functioning difficulties. Treat your whole child, not just your academic child. Every time you talk about suicide, you should list resources. And so I've listed some. These slides will be available. I don't know who's posting on this, but everyone is welcome to these slides. And I want us to just take the time to thank you all for having me. That was a lot in a little bit of time. But I wanted to say thank you for having me, and I would love to take your questions. We're going to take one at a time? Okay, gotcha.
Thank you so much, Dr. McGee, for that wonderful information. We'll have more another opportunity to speak with her later, and she'll also answer questions during our Q&A. And so we will reserve the questions for that time. So my name is Jessica Williams. I have the privilege of introducing our moderator and panelists. I'm going to read through this very quickly, but I did want you to know that you should have received an index card when you checked in. So for the brief Q&A that we will have, if you have a question, you can just hold up your index card. We'll collect it from you. We only have a few minutes for Q&A, so we may not be able to answer everyone's question, and we hope that you all understand, but we'll get to as many as we can. So with that, I'll start to introduce our panelists. So first we have our moderator, Dr. Sandra Barnes. Dr. Barnes is a licensed psychologist in Maryland with privileges to practice in 38 other states. She obtained a master's degree in organizational psychology from Columbia University and obtained her doctorate degree in psychology with an emphasis in clinical and forensic psychology from Fielding Graduate University. Dr. Barnes has worked in this field for over 30 years and currently operates the Center for Assessment and Therapy, where she conducts comprehensive psychiatric and forensic evaluations, as well as court-ordered competency to stand trial and violence risk assessments for the state of Maryland. She also provides therapeutic treatment to active duty service members. When she is not doing all things psychology, Dr. Barnes enjoys traveling, trying new recipes, writing, and reading good books. She is a wife and mother to 2 young adult children. Welcome, Dr. Barnes. Next we have Dr. Diana Abney. Dr. Abney is a noted primary care pediatric physician who practices in Waldorf, Maryland. She also serves as the health officer for the Charles County Department of Health. Dr. Abney has been a longtime advocate for children's health issues in the region, and during her career has served in leadership positions on several boards and commissions. Dr. Abney currently represents health officers on the Child Environmental Health and Protection Council and chairs the statewide advisory commission on immunization. Dr. Abney previously served as the medical director of the health department's Child Abuse and Neglect Prevention Program and the National Medical Association. Welcome, Dr. Abney. Next, we have Dr. Maria Navarro. Dr. Navarro is a veteran educator who has served in various teaching and leadership roles in Maryland, Delaware, and Washington, D.C. Dr. Navarro currently serves as the superintendent of Charles County Public Schools. She was the chief academic officer for Montgomery County Public Schools for 6 years and was the acting chief academic officer in Baltimore City Public Schools for 2 years. Prior to joining Baltimore City, Dr. Navarro worked as a senior level administrator for the Christian School District in Delaware and as a teacher and administrator for the Cesar Chavez Public Charter School in Washington, D.C. Dr. Navarro received her bachelor's degree from the University of Delaware, her master's degree from Temple University, and her doctorate from George Washington University. Welcome, Dr. Navarro. Next, we have Kelly Jameson. Ms. Jameson is a licensed clinical social worker and has been in practice for over 23 years. Ms. Jameson currently works as a student mental health counselor at the College of Southern Maryland. She is the owner and operator of Arise Therapy and Life Coaching Center, LLC. Her career in clinical practice, community mental health, and higher education has included service to diverse populations. Ms. Jameson is passionate about partnering with local schools, community agencies, and organizations to identify and address gaps in availability, accessibility, and utilization of resources. Ms. Jameson is the proud mother to a young adult daughter and son and has 2 granddaughters. Welcome, Ms. Jameson. And last but certainly not least, we have Darian McGee. Mr. McGee is a graduate student at Georgetown University School of Continuing Studies, pursuing a degree in sports management. In 2021, Mr. McGee obtained his bachelor's degree in business administration and finance from the University of Maryland. Mr. McGee is a former football player and previously worked for the Washington Capitals and Washington Nationals. He is the son of our guest speaker, Dr. McGee. Please join me in welcoming Mr. Darian McGee. Thank you all, and with that, I will turn things over to our moderator, Dr. Sandra Barnes.
Thank you, Jessica. Welcome everyone to our forum on public policy, addressing suicidal ideation and looking at ways to prevent and perhaps find a way that we can wrap our arms around this issue and come to some conclusion about what needs to be done. I want to on the outset just talk about a little bit about the objectives. We're here to further raise awareness about the mental health concerns of our Black youth. We want to try and educate about the issues and think in terms about how our youth are currently being impacted. You've heard from two speakers already about the numerous factors that are influencing suicidal ideation. We didn't talk a lot about the attempts or maybe even the intentions and the plan. But here today, as I speak with my panelists, we're going to get some insight and some understanding about what we can possibly do as a community to address this issue. I'm going to start with you, Dr. Abbey.
Right, because my name starts with A.
Start with A. And you're sitting to my right. So, from your perspective, from where you sit as our health officer, I want to know from your perspective, what are some of the barriers that you see in addressing this issue? What are some of the barriers to access to care?
Before I answer that was fine. Thank you so much. So there are quite a few barriers, and some of them we don't even think about. And one of them is ourselves. Because many times, as our speaker said, we, especially in our community, just don't address. Hear me? I'm sorry. I'll sit closer. Is that better? Okay. One of the barriers is ourselves. Because as she said, our community just doesn't do a great job of addressing mental health or behavioral health issues. So that's one of the big barriers. Another barrier is basic access to care, transportation. In some cases, maybe not everyone's case, gets access to insurance. Having a doctor or a therapist or even a teacher that you trust to speak to or that looks like you as a child, someone that you feel comfortable with. Feeling afraid that if you talk to somebody, they're going to judge you. Those are other kind of barriers, especially if you're a child or an adolescent, because we think, I'm sorry, I'm a pediatrician, I sometimes think like that. Sorry about that, I'm over now. I only have a minute left. Those are the big barriers. All right, like I said.
I'm going to move on. I'm going to ask Dr. Navarro, from your perspective, in the educational realm, what do you think is happening in the classroom? Is there anything you might want to add to what Dr. Abbey said about educational?
Yes, absolutely. So I think Dr. McGee's presentation is so spot on, and I cannot wait for her to come and do some work with our staff. I would say she spoke about parents and who's here in the room, but I would also tell you that my staff, there's a lot of barriers for them even talking about this topic all around. So we implemented a program called Signs of Suicide in Charles County, and we started with the adults, and we're starting, let me say, because we're not done, talking about this and sort of taking away the inability for people to want to communicate about the suicide issues and the things that lead to suicide. Because part of this is having these forums and talking through not just the statistics, but the behaviors. And so I just echo Dr. McGee's issues of addressing issues as they bubble up and informing our educators, our teachers, our administrators, our secretaries, anybody who is in the buildings, what are the warning signs that we can all think about, and then what do you do as an adult? Because educators are educators, and sometimes they can feel paralyzed not to act or refer to even our folks who are trained within our buildings, our counselors, our psychiatrists, our behavior interventionists. And so we're trying to also demystify this topic, and I'm just really happy to be here to continue to talk about this
And thank you, audience, for being here, because it is a sensitive topic, and it's a scary topic, right? A lot of people become very closed when we start to talk about suicide ideation, plan, treatment. And you mentioned something that I think that is key, and that is actually having a conversation, being able to recognize those signs. And so I want to go down to Darren, and I want to hear from the perspective of someone who's closer to the pulse of our youth in terms of what is it that you could say on behalf of that population that they're feeling, what are we missing? What are some of those signs that we are missing?
I think there's a stigma when it comes to seeking mental health from a Black youth perspective. I think that it's seen as less masculine to express your emotions in a vulnerable way. And so I think there's alternative ways that we do express that emotion, whether that be through suppression or accessing other more masculine emotions like anger. So.
Yes, anger. And we know that anger is not a default, and we know that when we see the anger, that is another voice for what lies beneath the anger. And very often, beneath that anger are symptoms and signs of depression, insecurities, and anxieties. Ms. Jameson, you're at the college, and so you're with a lot of youth within Darian's population as well. From your perspective, what are people showing up and saying about mental health? And are there things that we might be missing from that area?
Sure, thank you. I first want to point out that young Black men are the least population, that I see at the college. And I know it's not because they don't need to see me. So we do have an organization at the college called Men of Excellence, and because the young Black males don't come to me, I go to them a couple of times a semester to have discussions about what is affecting them, what makes it difficult for them to be successful, in college or in higher education. And just like Darian said here, there's a lack of support, from the men in their lives, even from the women in their lives. And there's this sense, just in the world, that they're supposed to be strong, be macho, that you don't need to go talk to someone, like, you can handle these things for yourself. And when we get into some deeper conversations, part of what I feel my job is to help them to realize is that you're not really doing yourself any favors by, kind of carrying that on. Help is available, support is available. And if you don't have that kind of support that you need within your family, it can be found in the community. We're here with a lot of the D9 organizations that are here. I see one of my sorors out there, just one. And so I think communities are making an effort. So I know that there are mentoring programs that many of the fraternities have in the community. And so I think the message has to be, you don't have to suffer alone. And you don't have to, mask the things that you feel, suppress the things that you feel, because counseling is confidential, it's private. So give that gift of support to yourself. That's one of the things that I like to emphasize with them. And I think they hear me because some of them do circle back to schedule an actual appointment to talk about things that might be going on in their lives.
Thank you, thank you. I think one of the things that stood out to me is that men aren't showing up, right? Not the way we see women showing up. I don't know why that is. I mean, we hear that women are more emotional, but is that really the case? Or is it, based on what we're hearing from the panel, that is more or less their expectations? And so we have to learn to manage those expectations that we have of our young men and our young women, and that we have of each other. And so I want to move down, back down to you, Dr. Abney, in terms of talk a little bit about the barriers, what you thought may have been some of the things that are keeping people away from the access to care. Can you talk more about what is out there, what is available from your perspective, or how we can make changes to make sure that we make things available? How do we remove those barriers, in other words?
So first let me say there is a shortage of counselors and those kind of things, psychiatrists, but they are out there. And so sometimes what you have to do is seek them out. You have to also trust your primary care physician or nurse practitioner or PA, whoever it is you see for primary care, because they have to begin with, some resources that and some ability to help with some of the problems. They are by no means the specialist, but they can get the ball rolling. And they can point your children and you into the direction of where you can get help for yourselves, because as you said, it's not just treating the patient, it's also treating the people around the patient. So how to get help for yourselves and how to get help for your student or your child. And then there's also other resources in the community. There are community organizations, there's your religious leaders. All of those people can be helpful, but the key is to seek them out. The other thing that's important is to make your child and the rest of the family feel empowered to seek out that help. Because as we've said multiple times, a lot of people don't really want to go for that help. And the last thing is something that is very big to me is watching what you say. Don't just say, oh, you'll feel better. Keep your chin up. Oh no, your friend committed suicide. No, your friend, and you corrected it a little while ago, who died of suicide. That's very different than blaming the person who had an illness, and that was the end of that illness, the terminal point of that illness. So all of those things can make it easier for people to seek help.
But one of the things that we need to continue to work through in our schools is the ability for students to learn how to talk about their emotions from the elementary level. Some of my best teachers in some of the classrooms that are doing some really meaningful teaching and learning, and I don't just mean academic learning, but overall learning about who you are as a young person and about yourself, have set up places within the classrooms where they validate the emotions that students express when they walk in. So you'll see in some classrooms, how are you feeling today? Let me know. And there's ways in which students can begin to talk about how they're feeling, talk about their emotions, and also that gives us as educators a context clue on how we need to care and treat the student depending on what they're going through. And that series of elevated, of indications from students then allows teachers to see if there is an elevator or a continuous concern of students telling us that they're not feeling well, and then what do you do to follow up on that? So what I also think is important to note here is that we're all in a process of learning more about the importance of mental health in the overall education process. So we're not just talking about math and science and social studies and the things you need to know there, but that an important component of that, and I will say in our health curriculum that emphasizes and has continued to be emphasized exactly because of Dr. McGee's data, that this is a problem that was impacting youth before COVID. It impacted youth and it impacted several communities even more through COVID. But even before COVID, the reason that a lot of the transitions of the health curriculum took place, at least in Maryland, was putting forward that mental health awareness by educators, that rising of the mental health and teaching early on students how to talk about their feelings, what they do with their feelings, what they're experiencing was part of the whole educational experience. I'll just say one quick note as we transition to the community piece. Last year we had a discussion internally, and I think Bella Lugo is here from the school system, who is leading a lot of our behavioral work in the school system. Bella, are you here? I'm not sure. Yep, I saw her. There she is. One of the things that we talked about last year was we can't just do this professional learning about signs of suicide or first aid mental health training to our staff. So this year, the school system began to implement for families, and we've been working on this, and part of my eagerness to be here this morning with the community that is looking back at me, because I know who you all represent, was trying to get the community to get the word out that we in the school system have implemented and will continue to implement first aid mental health for families, for parents and caregivers. And I was privileged enough to confidentially sit with one of the cohorts of parents who decided to take this course. And it is a course that allows you to understand the mental health of young people in all sorts of settings, outside of schools, how they're behaving, how they're responding. And I think most importantly, you as an individual, as a parent of teenagers or young kids, walk away with materials that give you information about who to call if you have concerns. So Dr. McGee mentioned the Trevor Project. There, you as a community member, if it's not your own children, if it's your grandchildren, your cousins, your friends' kids, you walk away with enough information to make sure that you're able to help a youth that you see and that you're involved in. So I just want to, I'm sorry, but I just want to put the plug there because I am trying to get more and more of our community members and our families to come into these very candid, very confidential professional learning opportunities, and with a structure like the first aid mental health curriculum, because it's a 2-day training and I think it's extremely valuable. It also talks about the topics of how to have conversations within communities that really don't or have had issues talking about mental health very openly. Thank you.
All right, so Dr. Navarro, in a nutshell, she's speaking about some of the resources. So I hope you all are taking some note about mental health first aid. And I know that they have that for youth as well as for adults. And there's also the assist program. And then there may be, I'm hearing the Trevor Project. So there are other resources that I think that you all can go back and read up on. And I think that at some point, we have an opportunity to tell people more about the mental health first aid. We're going to break out into our breakout rooms. Yes. So I want to talk about policy a little bit. What's happening politically with suicide prevention? Does anyone feel like they can speak on what's happening politically? What should we be doing politically to reduce those suicide rates? All right,
I'll take a stab at it. Well, one of the things that we're doing right now makes a difference. But doing these things with the people who make the policies and having these conversations with people like my friend Commissioner Addison or my friend Delegate Addison, so that they understand what's going on, what needs to happen, and that they bring it to their bodies and talk about it to see if there are things that they can do. Not necessarily laws, but at least policies about, how things can happen in our schools, how things can happen in our communities to make it easier for people to access care, to make it, even if it's something as simple as good advertising that makes people feel like, hey, this is normal. In fact, now I'm going to plug the Maryland Academy of Pediatrics. You may or may not have seen them yet, but we have 2 commercials. One is for adults, one is for children. They're both on the same platforms. But it's basically saying, listen to your child, talk to your child. When I say I'm sad, I'm sad. When I'm not doing the things I normally do, pay attention. And just putting that information out, and then making schools like Dr. Navarro is talking about, making her schools, where they are trying to do things to make sure that the kids feel important and that they can express their attitudes and their feelings in class. All of those kind of things make a difference. And frankly, in America, things start with policy. So you got to charge.
Thank you.
Absolutely, absolutely. And so while we're talking about policy, one thing that Dr. Abney mentioned earlier was that it's not just the lack of access to care because of transportation, but it's also limited resources. And so what I'd like to also charge our politicians to do is perhaps to think more in terms of how do we recruit and how do we retain within our Charles County, Southern Maryland area, those who would be able to help with this phenomenon, because it really is a pandemic at this point. Yes, ma'am.
Sorry, I just wanted to add one thing around this. So, the access to, so one of the things that we found in the school system is we over the last couple of years have increased the number of behavioral specialists in our schools. But that is very, 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 very difficult to do. We're struggling. We put out an RFP to the community, to private providers that are treating families locally or regionally, to be able to do specific work with case management and support for a cadre of our students who need more supports than what a school counselor can do or a psych. Because we regionally have had difficulties, and I'm glad you brought this issue up, finding more and more supports, we also instituted telehealth access for our students. So we're triaging the ways in which we bring more mental health and behavioral supports to our students. So we are this year trying out telehealth for a specific cadre of students. But I think this really is within the intricacies of how we expand the workforce to be able to meet this demand. And I think we're seeing it throughout, and it is a continual struggle to be able to think about how to do that. And in Southern Maryland, and in Charles County in particular, I find that sometimes by the time the mental health or the behavioral health community is supporting other counties, they don't quite make it to, they're already booked by the time they come down with meeting the needs in Charles County. So I very much think that one of the things that we need to continue to talk about and think about what progress we do every single year is the behavioral health supports for youth in the county. Absolutely.
Thank you. I'm going to ask one last question before we allow the audience to engage a little bit more deeply with the panelists. So what I heard Dr. McGee talk about was that gap between parents and children. And it sounds more like a generational gap. And so I'm going to bounce this question over to you, Darian, and maybe Ms. Jameson, you can also step in because you're with that population as well. I want to hear more about how youth can take the initiative in their own self-care, right? Because we're telling you what we think you ought to be doing, and what I'm hearing is there's a disconnect. So I want to hear more about your thoughts, your ideas. It doesn't have to be anything that's concrete, but just give us some ideas of what youth can be doing to take more of the initiative for their own self-care and mental health.
Well, I think for me, personally, I think you need to find a way to better your mental health that's comfortable for you. Because a lot of people see one-on-one counseling and things like that, and they're not really comfortable in that setting. So, other communities like church communities, like sports psychologists, or people that work with you in a field that you feel the most comfortable in, I think can really help.
I appreciate that. I appreciate that, especially being a psychologist. You talk about the individual setting, one size does not fit all right? So thank you for passing that along. Yes, ma'am.
Something. We don't have enough psychologists. I mean, we don't have enough black psychologists. We got about 44,000 in a country of 330 million people. So we have to come up with creative ways of addressing problems that don't have to do with the psychiatrists, the psychologists. And so we have to be expansive and not, narrow in our focus. So if it's mental health coaching, if it's mental health first aid, if it's a teacher with some training, we have to combine all of our community to address these issues, right? And it's not gonna just be the psychologist, and it's not gonna be always a black psychologist, because the typical matchup is a white woman and a black boy at a school. Okay, and so, we have to look at all of the community to try to help solve these issues.
Right. So we're talking about more or less trying to engage from a different way. We're talking about reframing how we see those relationships and learning to establish trust with other people outside of just who looks like us, right? And there's a charge that's going out. Is mental health, first aid can be something that everybody in the room can be certified to do, right? All right, Dr. Abby, final words?
Yeah, for that. But I said it a little while ago, you also have to trust your pediatrician or whatever clinician that you see. Because we are not psychiatrists or psychologists, but we know a heck of a lot about the mind and the body of children and youth. And we are very comfortable with having those conversations with them if you let us. Quick story. The other day I got called from one of my staff members who said, this child did a PHQ-9, which is a screening for depression, which is a vetted tool for screening. Parents were like, oh no, she's not depressed. We don't want to hear it. Don't put it in her chart. And let me talk to Dr. Abney because you're wrong. Well, I'm not going to go against that. My clinician is correct. What I'm going to try to do is get her to let me talk to her a while till I can get her, send her to see a psychologist or psychiatrist. So when your children say they're sad or if you see a difference in them, believe them and find them some help. And there are not enough of you. I wish there were. But then trust on the other people, your minister, your pediatrician, whomever that you can so that your child can get the help they need. But believe them and take care of them and wrap them in your arms.
If I could just have a brief word about, I'm still out there trying to train local confidence, talk about ways openly, consult with people, because we have the population of clinicians that we have, and the way that we do our training, which is what I'm out there fighting for now, it's not going to change quickly. So we have to still be out there asking clinicians to think about children globally, to consider trauma in their treatment, to consider the fact that we're in a country with this racial issue. And so those issues are not going anywhere, and I just felt bereft that we had not addressed them on this panel,
All right, so Jessica's coming up, and we're gonna now take questions from our audience.
Yes, can we applaud our panelists? Okay, so we are going to now take questions. We're going to take 5 questions from the audience. You should have received an index card. I see we have one over here. If you need an index card, you can get one from Latisa. She'll be walking around as well. Please write your question down, and then we will present it to the panelists. And just as a few, I'll just talk you through. So since we have a lot more adults than youth today, we're going to stay in here for our adult breakout session, and then our youth breakout session will be in the room immediately behind us in room 104. That will be facilitated by Dr. McGee. Even if you aren't a youth, if you want to join in on that youth discussion, you can feel free to go to the other room, but if you want to stay in here for the adult discussion, that's fine as well.
Okay, for our panelists, our first question, which is from one of our youth attendees. How do I create a safe space? Hold on, let me read it. How do I create a safe space? As an educator and friend of individuals that struggle for mental health, what are some coping skills to deal with our loved ones when they are going through spouts of crisis without reacting with reciprocated emotion? The panelists that want to say that.
That's a great question. You know, I think when you mention a safe space, That is so subjective to so many, and I think when we talk about mental health, as far as the community goes, the breakdown that we see sometimes in the family, kind of is indicative of the breakdown that we see in the community. So a safe space has to look like what it looks like to that individual. Is it an uncle? Is it a parent's friend? Is there someone around you that you can speak to openly, even if it's not your parents or your family, or you're dealing with someone in your family? And I think I'm finding it harder as a college counselor that one of the questions when we ask, do you have a supportive person or a church family or a neighbor or anyone? And younger people are feeling like they don't have a direction to go in. So as far as a safe space, there's got to be someone around, a school, a neighbor, someone. But then I also wanted to address what you mentioned about not reacting, that part of the question, and coping skills, which I think is another thing that is kind of lacking, because a lot of our young people grew up with their best friends all around them and their computers that they walked around with. And so relationships didn't develop in ways that they had in the past. So coping can be whatever an individual finds is useful. So if that's video gaming, if it's writing, if it's journaling, if it's exercise, if it's writing rap or other creative things, whatever gives that individual an opportunity to decompress and to detach from whatever the stressors are that they're dealing with, I think it's fine for us to engage with that and normalize the differences in coping and to encourage ways of coping that, us older folk may not see as ways of coping, but to allow that to be something that we embrace for that person's individuality, for their identity.
Thank you. So our next question says, good morning. Yesterday, my son's principal sent a letter to parents regarding a burn book and a kill book. The notebook included a list of students they do not like and would like to unalive. What is the school doing regarding these students that may have been on the list, and what is the school doing to help children understand it's not okay to do these things? And it's very alarming because my son is in elementary school.
So this isn't the first time that we've seen this, just so that you know, and we have seen it a couple of times happen at the elementary level, it's not just secondary level. This incident did occur, and the first thing that we do is we do a behavioral threat assessment, which is a process that we look at to see the degree and the level and the issue with the student specifically. What are the issues of the student specifically? We work very closely with that particular student and their family and the school psychologist to follow up on them. We also have to do a safety assessment for the rest of the students to really assess the safety level for their counterparts and their peers. I can't speak about the specifics of the case, but what tends to happen is that we have to make sure that the rest of the students are safe, and then we double down with supports for the specific student and do a follow-up. And many times that is a very loud outcry for a student saying, I need help. And so for us, it is a what now that we've heard you, what are we doing about it? And so we begin to work with local organizations for deeper support for them and their family. But to the parent that got the letter yesterday that we sent out to that specific school community, we have also addressed the immediate safety concerns of the rest of the students in the classroom, and we've assessed that based on several protocols that we follow to guarantee the safety of everybody else in the classroom. But our current immediate attention, based on that specific incident, is that we're currently doing some follow-up with that family and getting more clinical supports for the student and the family.
Thank you, Dr. Navarro. So the next question we have is, are children at 5 years and below being diagnosed and treated for mental health matters as part of their overall evaluation, annual evaluation with their pediatrician?
The short answer is yes, they are. And yes, bottom line is yes, they are. When they're old enough to write and ask specific questions, we use screening tools that are written screening tools. But we watch how they behave. We listen to what their parents say about the children and what they've done and what they haven't been done and doing, sort of like what Dr. Navarro said. If someone tells me something very different is going on with their child, or something that is very concerning, like injuring animals or tearing up all their toys or throwing everything away, I listen. And then I have a conversation. I'm meeting a pediatrician, not just Diana. Listen, and we have a conversation with the parents, and we try to express to them what our concerns are. The problem is, so many parents don't listen to us. They're like, oh, she's just 6. She's not depressed. How can a 4-year-old be angry at the world? They can. It happens. They see everything that's going on around them, and children have, mental illnesses also. They don't all start when you go hit puberty or when you go out to the workplace. Okay, professional.
It's usually done in connection with a parent. You can't place a child, a 5-year-old, back into a system on their own. And so I usually, when I used to see really young children, I used to do every 4th session with the parents, just built in to start thinking about parent guidance. How do you incorporate, how do you address? And basically what you were saying is, how do you take the parent through that grieving process that something is wrong, right? Or something is atypical. And it's a process, and it needs to be done with sensitivity and compassion, right? For parents, and no judgment, right? And when you create that environment and take people through that process, you're benefiting the child and you're benefiting the parents.
I'm going to put in a plug for having a primary care physician or nurse practitioner for your child, just like for yourself, because it's a lot easier for me to tell that to the mother and father whose child I saw in the nursery than it is for an urgent care person to say that to your child. And you know that that pediatrician is going to stick by you and your child through that. And that's very important.
Okay, so this will be our last question before we transition into our breakout sessions, and this one is specifically for Dr. McGee. People feel more comfortable talking to people who look like them and have shared experiences. Due to the shortage of Black therapists in our area, how can people seek resources, and how can they be fixed?
Y'all may not want to hear this, but you just got to be persistent. You have to track down people. You have to call them more than once. I wish it wasn't. I try to call back everyone, but a lot of clinicians are so busy, so overwhelmed. I'm not excusing them, I'm explaining them. But you have to ask for, on your health plan, do you have a list of African American therapists? You have to ask your pediatrician, do you know of an African American therapist? Could you call them? Because if you know them, could you get them in? I get a lot of calls from that. You have to be persistent. There are lists and resources, therapy for Black girls, Psychology Today, a lot of resources and directories that you can search therapists for. You also have to look at your payment systems, if you have insurance, if you have a health savings account. You have to be crafty. You can even talk to a clinician about their rates. You have to be, what I encounter with African American parents is you have to be just as thorough as you can be to try to find the right person. Now I'm going to say this, again controversial, it might not be a Black person. It might not be the person that answers the phone, because not every Black therapist is at the stage where they can treat your child. They're not at the stage of processing their own trauma. And so you don't want to, one of my friends jokingly calls it Black on Black crime. You don't want, to get a therapist that is not suited for your child. And so I'm, again, keeping it real. and recognizing that you have to find the right therapist for your child. People say all boys need black men. They may not. They might feel threatened by having an African-American male therapist. They might feel better with a woman therapist. So be thorough, but what I want to encourage y'all to do is to seek guidance, because what I see is a lot of times parents dismissing teachers, dismissing white people, dismissing, the fact that there is something going on with their child. Find somebody you can trust, that you can talk to. It would be good if they're of color, but if they're good, that's a secondary, that's always great.